Hello everyone, my name is Latif Adekweju. Today we will be covering or discussing Unit 2 titled Primary Health Care Concept and Principal Structure under the course NSC 303. I hope you will enjoy today's facilitation. Thank you. In this Unit 2, you will learn about the concept of primary health care, known as PHC, and the related principles. On completion of this unit, learners should be able to discuss and explain the concept of PHC, define PHC, list the elements of PHC, explain the principles of PHC, and finally, explain and illustrate the role of a nurse in promoting PHC. As a way of introduction, in Unit 1, you were facilitated on the concept of health and prerequisite for good health. It was explained to you during our facilitation class and during the PowerPoint presentation that health is a state of physical, mental, and social well-being of an individual. It is not merely the absence of disease or infirmity. You also learned how health is affected by factors such as hereditary, environment, lifestyle, socioeconomic status, health services, and so on and so forth. In this second unit, we want to understand and know how an individual or community can attain the three important dimensions of health. What are these dimensions? We look at the physical, the mental, and the social well-being as we focus on PAC, so that an individual can attain a desirable health of a desirable level of health. The Alma Ata Declaration has stated that primary health care is the strategy to achieve the goal of health for all, which we mentioned in our first unit. And Nigeria as a country is committed to achieve this goal. The concept of PAC, known as primary health care, is about giving people an essential care which is acceptable, accessible, affordable to an individual, community, and the country as a whole. You will also learn about the components and the principles of PHC. Primary health care concept, what it is. PHC is simply put as a widely disseminated concept, but most of us are still not clear as to its current meaning. Therefore, we want to understand how the concept of PAC has evolved. PAC has evolved from re-examination and evaluation of existing healthcare approaches and assimilation of new experiences. The implementation of new knowledge and technology in terms of vertical program for eradication of disease did not achieve expected results, and it was realized that there was a need for establishment of permanent health service in the rural areas to deal with the day-to-day work in the control and prevention of diseases and promotion of health. It was realized that the world's priority health problems require development of new approaches for their solution. Hence, the approach in health services was shifted from curative to a preventive approach, from urban to rural populations, from privileged to the underprivileged, from on-purpose to from unipurpose to multipurpose workers, and from vertical mass campaign to a system of integrated health services, forming a component of overall social and economic development. Concept of primary health care. As illustrated in this figure, you will see at the center of this figure is concept of primary health care, known as PHC. Then at the top, you have conceptualization of basic health service, accessibility, availability of health services in rural population. At the right side of the figure, you have re-examination and evaluation of health services, correlating health with economic development. And at the bottom of the figure is shift of emphasis on preventive approach from curative approach, urban to rural, privileged to underprivileged, and unipurpose to multipurpose workers. And lastly, by the left side of this figure, you have the illustration as International Conference on Primary Health Care and Malta Declaration. And so you see the progression of this concept of PAC. It started with basic health service approach in 1970. Then it progressively, which covered the accessibility, availability, acceptability, affordability, and appropriateness of service to a community. Then it progresses. In May 1977, the World Health Assembly also adopted another concept known as health for all to be achieved in 2000 AD. Then in 1978, there was an international conference on primary health care at Alma Ata, then in the then USSR, jointly by WHO, which is known as World Health Organization, and UNICEF, which also come with this concept of the definition of primary health care, which we now adopt today and we've been using. This clearly indicates that PAC concept has its roots in the initial stages of our national health care approaches. With all this said, and with all this concept in mind, we are going to proceed to defining PAC. We want to look at the definition of PAC and what the definition of PAC is. Definition of PAC, primary health care. In Alma Ata Declaration in 1978, is defined as essential health care that is based on practical, scientifically sound, and socially acceptable method and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. What do we mean by accessibility? It simply means continuing an organized supply of care that is geographically, financially, culturally within easy reach of the whole community. What do we mean by acceptability? Acceptability simply implies that care has to be appropriate and adequate in quality and quantity to satisfy the health needs of people and has to be provided by methods acceptable to them within their socio-cultural norms. Affordable implies that whatever the method of payment used, the services should be affordable by community and country. Appropriate technology, which means using appropriate methods, techniques, and locally available supplies and equipment, which together with the people using them can contribute significantly to solving a health problem. Hence, we can say PAC is a practical approach to make essential health care universally accessible to individuals, families, and community in an acceptable and affordable way and with their full participation. So, PAC focus on promotive, preventive, curative, rehabilitative, and emergency care to meet the main health problems in the community, giving special attention to the vulnerable group such as mother and child. Are the elements of primary health care. The levels of PAC involve 8 essential elements, or also known as components of primary health care, as outlined in the Alma Ata Declaration. What are these? They are: 1. Education concerning prevailing health problems and the method of preventing and controlling them. 2. Promotion of food supply and proper nutrition. 3. An adequate supply of safe water and basic sanitation. 4. Maternal and child health care, including family planning. 5th, immunization against major infectious disease. The 6th one is prevention and control of local endemic disease. 7. Appropriate treatment of common diseases and injuries. And lastly, provision of essential drugs. Okay, in our previous slide, we talked about the 8 components of PAC. And now on this slide, we are looking at the principle of PAC. Don't forget, the component of PAC is not the same as principles of PAC. And so basically, the PAC framework has 5 principles that is guiding it. And what are these 5 principles? They are: 1. Equitable distribution of resources, manpower development, community involvement and participation, appropriate technology, and lastly, intersectoral coordination. These principles are also illustrated in figure 2 in the next slide, and each of these principles also will be discussed in details as we continue in this lecture. Equitable distribution of resources. What is it? The attainment of a high level of health is the fundamental right of an individual, or you can simply say that all human beings have an equal right to health. You will be interested to know how people can ensure this right. The answer is that all the people of the world or country should be provided with equal opportunity to develop health to the fullest and maintain it. Therefore, what is equitable distribution of health? It simply means that health services must be shared equally by all people irrespective of their ability to pay, and all the people, rich or poor. Whether you are rich or whether you are poor, whether you are in the city, whether you are in the rural area, you must have equal opportunity to health services. And you must also have access to health facilities, health services. If we look at health statistic, you will find that the health situation as indicated by health status indicators, e.g., infant mortality rates, known as IMR, maternal mortality rates, birth rates, death rates, and so on and so forth, is lower in urban areas than in rural areas. Why this difference? Why is it so? It is simply because health services are mainly concentrated in the cities, in the towns, in the urban area, thus resulting in inequality of care for rural people. These statistics reflect how health-related resources are distributed with the countries, including access to health services, education, and income earning opportunities. This is called social injustice. The inability to receive health care services by majority of rural people and those living in urban slums is inaccessibility. The aim of PAC is to bridge this gap by shifting this concentrated healthcare system from cities or urban areas to where people are living, more to the rural areas, where three-quarters of the people live, which is in the rural areas, and bring the service as near as possible to them. The other features of health inequality is society is in society is health status of women and the disparity in health between genders, which indicate that women suffer more from health problems than men. Why, why so? This is a critical indication of health inequality. What can you, as a healthcare provider, do about all this? You can only provide care to an individual, to someone who is diseased or healthy, irrespective of any disparity. But in general, this fact calls for explicit policy and strategies to reduce inequality in health. The next principle we want to look at is manpower development. Don't forget, we mentioned the 5 principles of PAC. We've looked at the first one, which is equitable distribution of resources. Now we are on the second principle, which is manpower development. The manpower development in the context of health includes both professional and auxiliary health personnel, members of the community, and supporting staff. It aims at mobilizing the human potential of the entire community by making use of all available resources. This can only be achieved if the individuals and families accept greater responsibility for their health. PAC focus on education and training of health workers to perform functions relevant to countries' health problems, reorientation of health personnel, planning health manpower according to the needs of health system in terms of the right kind of manpower, the right number, at the right time, and in the right place. At the first level of contact between individual and healthcare system, PAC is provided by community health workers acting as a team. These workers have to be trained and retrained so that they can play a progressive role in providing primary health care. The second categories of health personnel are traditional medical practitioners and birth attendants. They are often part of the local communities, culture, and traditions, and exert great influence on local health practices. Therefore, these indigenous practitioners needs to be trained accordingly for improving the health of the community. Lastly, we can say that family members are often main providers of health care, mainly women. Women play an important role in promoting health of ourselves, of our family. Thus, we can contribute significantly to primary health care. I mean, the women will contribute significantly to primary health care, especially in ensuring the application of preventive measures. Women's organization can then be taught and encouraged to discuss on questions as nutrition, childcare, sanitation, and family planning. School teachers and adolescent girls can also be trained on human sexuality and home nursing. Similarly, young people can be educated on health matters. They can be effective in carrying these messages to their homes, thus promoting PHC. Our third principle that we are looking at is community involvement participation. What is it? It's simply the process by which an individual, families, and community assume the responsibility in promoting their own health and welfare. By their own health decisions, they develop the capacity to contribute to their own and the community's development. Realizing the fact that the community can become the agent of its own development, a continuous effort should be made towards the involvement of the local community in planning, implementation, and maintenance of health services. Community involvement is partnership is established between governments and local communities in planning and implementation of health activities. What is its aim? It's simply to build a local self-reliance and gaining social control over primary healthcare infrastructures and technology. The individuals in the community know their own situation better and are motivated to solve their own problems. Thus, it can be stated that involvement of community in health matters will require attainment of capacity by individuals to appraise a situation, weigh the various possibilities, and estimate what can be their own contribution. The individual in this community, because they know their situation and understand and are motivated to solve their common problems. All this means acceptance of a high degree of responsibility by the individuals for their own health care. For example, by adopting a healthy lifestyle, by applying principles of good nutrition and hygiene, and by making use of immunization. Third principles we want to look at is appropriate technology, which simply means that this technology that is used at the PAC is scientifically and technically sound, to adaptable to local needs, culturally acceptable, and financially feasible. The health for all targets require first and foremost scientifically sound health technology that people can understand and accept, and which the non-expert can apply. For example, oral radiation flu, locally prepared winning food and stand pipes rather than house-to-house connection. Cooperative food stores. It is socially, economically, and professionally acceptable to take the technology closer to the people, consumer, wherever possible, e.g., making ORS or dehydration salts for babies available to mothers in every home is likely to be more useful than expecting the mothers to take the baby to the special center. The concept of appropriate technology can further be explained by taking the example of ORT, oral radiation therapy. This pack of ORT for diarrhea prescribed by WHO can be made available to each home, so the community is taught how to prepare sugar and salt solution to combat dehydration in a child with diarrhea. Intersectoral coordination, the last principle. The health of an individual, family, community is affected by other sectors in addition to health sector. PAC cannot be provided by the health sector alone. PAC require the support of other sectors, such as development and implement to develop and implement an effective PAC. These sectors includes economic development, anti-poverty measures, food production, water purification, sanitation, housing, environmental protection, and education all contributes to health. Development of PAC will rest on proper coordination at all levels between the health and all sectors concerned. PAC involve, in addition to the health sectors, all related services and aspects of national and community development, in particular, agriculture, animal husbandry, food industry, education, housing, public works, communication, and other sectors. The importance of agricultural sector, water supply, sanitation and housing, communication and education sectors, as well as mass media, is essential in the health in primary healthcare developments. Each of these sectors is further explained. Agricultural, water supply, sanitation and housing sector. When we say agricultural sectors, it ensures the production of food for family consumption. Also, nutritional status can be improved through programs in agriculture, e.g., Grow More Food and kitchen garden projects. Similarly, you know that water supply is very important for household use. A regular supply of clean water helps to decrease mortality and morbidity, in particular among infants and children. You are aware that many diseases like cholera, typhoid, diarrhea, viral, and waterborne disease. Housing has a positive aspect on health, and this is probably if housing is properly adapted to local climatic and environmental conditions. the health of the people will be improved and there will be less challenges in their health. What about communication, education, and mass media sector? Television and radio communication serve as important vehicles for learning regarding health and health practices. Mass media can play a supportive educational role by providing valid information on health and ways of attaining it, and depicting the benefits to be derived from improved health practices, help to create awareness regarding various health programs, that is, family planning, immunization, growth monitoring, diarrhea disease, and ORS, and so on and so forth. In the people who are isolated, I mean people in the rural area, community education help people to understand their health problems, possible solutions to them, and the cost of different alternatives. What about instructional materials and literature? This can also help to develop to be this can be distributed as educational system. Associations of parents and teachers can assume certain responsibility for PAC activities within schools or the community, such as sanitation programs, food for health campaign, or courses on nutrition and first aid, adult literacy programs, kitchen garden projects, courses on human sexuality, and nursing. The role of a nurse in primary health care is mainly four, as identified by the World Health Organization in December 1985. What are these roles? As illustrated in Figure 3, we have the nurse as a direct care provider, the nurse as a teacher and educator, the nurse as a supervisor and manager, and lastly, the nurse as a researcher and evaluator. The nurse as a direct care provider. What do we mean? You as a nurse needs to develop a variety of skills which you have to utilize in both clinical and community settings in order to participate actively in providing care in relation to the component of PHC. For example, if we take one of the components of PHC, that is control of communicable disease in the PHC, community centers and hospital is to identify and give immunization to children and educating the parents regarding the control of these diseases. Similarly, in providing MCH, that is maternal and child health care, you as a nurse, or you as healthcare provider, do not only have to examine the mothers to identify the risk factors or give TT, tetanus injection, but also you have to teach them about immunization, nutrition, rest, sleep, exercise, and so on and so forth. The second role of a nurse is a teacher and educator. Your central concern as a nurse is promotion of health, prevention of disease, and disability. This calls for your role as an educator when you have to educate the individuals and families about healthy lifestyle and the community on the primary prevention of ill health, as well as protective and supportive health measures. Your role as a teacher involves the training of other healthcare personnel, professional colleagues, and auxiliary personnel as supervisor and manager. If you are engaged in providing PHC, you have to exercise some kind of leadership. Your duties in this regard include supervising other personnel in providing care, planning health services for the community in conjunction with other members of the health team, and organizing and administering community health services. While performing these functions, you are involved in assessing the health needs of the community. You are listening to the community's view on these needs, as well as communicating with the community and advising them accordingly. Lastly, the nurse as a researcher and educator. PHC system is dynamic as it deals with living human beings. Hence, a nurse has to be dynamic in her services by bringing about changes and innovations in the healthcare provider based on facts. For this, the nurse has to be prepared to take role of a researcher and educator. This role involves monitoring, observing, analyzing the health conditions, health services, and the health care provided. For example, when an individual falls sick, then you as a nurse, as a primary health care nurse, are in a better position to determine the individual patient's health needs and to understand problems involved in the meeting these needs. With your knowledge and skills, you are able to recommend changes or innovations in primary health services. For you to play this role effectively and efficiently, you need to have updated records. Before we just finish discussing in details the four roles of a nurse, we looked at each of these roles that the nurses has in the PAC, and that brings us to the conclusion of this unit. In this unit, so far, we have discovered the concepts or discussed the concepts and definition of PHC. We understand that primary health care is a practical approach to making essential health care universally accessible to individuals, families, and community in an acceptable, affordable way and with their full participation. We also look at the elements of PHC, which are education concerning preventive health problems, promotion of good supply and proper nutrition, adequate supply of safe water and basic sanitation, maternal and child health, immunization, treatment of common diseases and injuries, and prevention of drugs and vaccine, and the principles of healthcare have also been explained. And so I want to thank you for your participation in this online facilitation. I hope you have been able to gain new knowledge to what you already have. I encourage you to please go through this slide and listen to the instruction and